All right, it looks like there's some interference. I'm sure our engineers are going to have to instruct Dr. Vivian on what she needs to do in terms of the ambience, the environment from which she's speaking to us. We have a lot of interference coming from other sources. We try to usually get done in the first part of our conversation with the Skype connection, because sometimes it can be problematic. But let's get now to the studios and bring in Dr. Chris Otaboh, who is of Alliance Hospital. We've had you in the studios here in the past. We've also had Dr. Otaboh, with regard to discussing various dimensions of COVID-19. But today our focus is on healthcare workers who are on the front line. What is it that you're getting to hear from your colleagues, and that you yourself are also seeing with regard to the containment, if not abatement, of COVID-19?
Thank you very much for having me. I'll start by really appreciating the leadership of the country, starting from Mr. President to the last man in the field, for doing a very good job in terms of response to the pandemic in Nigeria. And so much effort is being put in and results are coming in. But still talking on that, I would think that there's a missing link somewhere. I think as a doctor, the national president of the Nigerian Medical Association ought to have featured in the presidential committee on COVID-19. Why did I say so? That's where the problem, I heard you ask the Honorable Minister for Information about the Chinese doctors issue. The reason why this problem is because of communication gap. There's a mismanagement of information. If the enemy president was in that committee, I believe that he would have had all the perspective, and he and the Minister of Health would have come out to address a joint press conference. That would have put paid, because it's having a negative effect on the fight. Because someone that is leading over 30,000 doctors in the battle, I don't understand why he should not feature at the highest level. Coming back to the medical workers who are in the front line, we are all exposed. Yesterday, the 100th doctor died in Italy. 100 doctors. You know what it takes to train one doctor, and 100 of them have been slaughtered in these last few months because of exposure, because of risk. So every doctor who is practicing in Nigeria is at risk. And that's why we're talking about protection, personal protective equipment. See, the people that would end up in the isolation centers, they don't go there as a point of first call. They go to the regular hospitals, they go to the general hospitals, they go to the private hospitals. And unsuspecting healthcare workers would already be exposed before they are identified. Remember the story of Dr. Stella, who lost her life in the Ebola crisis. It's not far from it now. So the people who have the highest risk of exposure are the healthcare workers. And so we must pay attention to the needs of the healthcare workers, and training and retraining, and then create incentives for the healthcare workers so that they will be able to muster all the energy to be able to push this virus out of the country. I think that will be my opening statement.
All right, thank you. The sky is through now. Let's return to Dr. Vivian Kwahe, because in the question Nigeria at the moment. Let's return to Dr. Chris Otaboh. Dr. Chris Otaboh, Dr. Francis Adebayo Fadil raised a very critical point here. He said that those who have symptoms of COVID-19 usually go to regular hospitals, without without feeling that he or she may have it. And again, the medical personnel in such hospitals wouldn't know as well, and they're not properly protected, and then they will normally attend to them. This is another way of perhaps spreading this disease. based on what he said. Now, how can such situation be tackled? Or what could be done for other health givers in different parts of the country, key into the COVID-19 situation and know what they could do differently?
Thank you very much. I just can't continue without appreciating Dr. Kwari and the other healthcare givers who are battling to save the situation. Thank you very much for what you are doing. For me, the biggest threat that COVID-19 poses is not even the symptomatic people who come to the hospital, but the asymptomatic ones, those who are infected but yet they don't have symptoms. Those ones who come to the hospitals to do appendectomy, they will come to the hospital, haven't had injuries, and they will present to the hospital. And the fact that they are not having symptoms does not stop them from infecting others. And so, whether they have symptoms or they don't have symptoms, what is important is that we take a universal precaution, assuming everybody to be positive. That's the best thing to do. For the ones who come with symptoms, there's supposed to be a protocol. There are a combination of symptoms that heighten your suspicion. And for those people, in fact, from the gate, there's supposed to be a temperature check. If the temperature is high, they don't come into the normal place. There should be an isolation area in the hospital where they are attended to. And because now they've given the sign, you follow suit and make sure that you don't mix them up. Okay? But for those who are asymptomatic, they have been exposed, they have been infected. Don't forget, about 80% of people would not show anything serious. Most of them will just be fine. But yet they can infect others. So because of that possibility, every doctor working in Nigeria now, especially in the cities where COVID has been diagnosed, must assume every single patient to be positive, and therefore take the necessary precautions. So you don't touch patients directly. If not necessary, you don't have to examine. Consultation, e-consultation should be encouraged now. All the elective cases should be shoved aside. Hospitals should just manage emergencies. I mean, someone who has had a fracture for 6 months and is coming, says he wants to fix his fracture, it's not necessary now. Push it until after the COVID is over. If there are things that can be pushed, push them. Just take care of the emergencies and take care of them as though you are dealing with an infected patient. If we do that, we'll be able to curtail the spread. But the problem is the finances. We lack, most hospitals lack the personal protective equipment. Most doctors have not even, many doctors have not even seen it. And yet, they are in the front line, they will be treating patients.
Okay, Dr. Otaboh, thank you very much. I want to bring in again Dr. Dorfa. I mean, I remember sometime last year on Good Morning Nigeria, we had you, and then you were talking about a new...
Receiving patients in an unsuspecting manner. We have to get them trained.
Okay, Dr. Boja, thank you very much. As I said, I mean, we're having to wrap all of this up very quickly. In addition to the donations that you are saying should be used for training, part of the donations could also be used for the payment of premium for the insurance in this emergency, assuming the governments, states and federal, do not have enough monies laid out for this particular purpose. Dr. Chris Otaboh, thank you very much for being with us on Good Morning Nigeria. And Dr. Boja, always a delight having you. And the pioneer CMD of University of Abuja Teaching Hospital, Dr. Nandul Dorfa, thank you for being with us on Good Morning Nigeria. We also would like to thank all those who sent in their tweets, our regulars, Elijah Ngala, Dele Jack Solomon, Titus Mondenok, Mike Ayan, Kwamagbola Hombabs, Adejumo Paul, Bashiru, Sandy Michael Amakoji, Olakunle Sharon, and several others. Thank you for being with us. Good Morning Nigeria returns on Monday, same time, 7 o'clock in the morning. Until then, don't stay safe, because health is wealth. I'm Kingsley Osadolo.
And I am Kirian Umayo. Happy Easter to you all.